Do you remember Robert Martinez, the 79-year-old man who nearly died from fake medications after scammers convinced him he had dangerous inflammation markers? The criminal network that targeted Robert didn't disappear after his story went public. They simply evolved their methods and found new victims. This is the story of how that same sophisticated medical fraud operation targeted 77-year-old Katherine Walsh from Portland, Oregon, using nearly identical tactics, but with a terrifying twist involving fake kidney disease results. Katherine's experience reveals how these medical scammers operate as an organized network, sharing victim information and refining their psychological manipulation techniques. By the end of this video, you'll understand how these connected medical frauds work together, and why stopping one scammer doesn't end the threat to seniors seeking medical care. Stay until the end, because Katherine's story connects to an even larger pattern of medical fraud that's still targeting vulnerable seniors across the country, and her investigation uncovered connections that will shock you. The familiar warning call it was a Tuesday morning in January when Katherine's phone rang with a call that would sound disturbingly familiar to anyone who remembers Robert Martinez's story. She had just finished organizing her weekly pill dispenser when her caller ID showed what appeared to be a medical laboratory number. "Mrs. Walsh? This is Dr. Jennifer Coleman from Northwest Medical Laboratory Services. I'm calling about urgent results from your recent comprehensive metabolic panel that show critical kidney function abnormalities requiring immediate intervention." Katherine was confused. Like Robert before her, she hadn't had any recent lab work done. But Dr. Coleman continued with the same practiced medical authority that had fooled Robert, using official laboratory terminology and creating immediate health panic. "Mrs. Walsh, your creatinine levels are dangerously elevated at 4.2, and your BUN readings indicate severe kidney dysfunction. Without immediate treatment, you're facing complete renal failure within weeks, which would require emergency dialysis or could be fatal." The caller knew Katherine's age, address, and even referenced her history of high blood pressure. The same type of personal medical information that had made Robert's scammer seem so legitimate. Dr. Coleman spoke with frightening medical knowledge. "About kidney disease. I need to stress how critical this situation is. Your kidney function has declined by 60% since your last tests. This level of renal deterioration typically indicates advanced chronic kidney disease that requires aggressive intervention to prevent complete organ failure." The network's evolved strategy. Dr. Coleman continued her explanation using the same sophisticated medical terminology approach that had trapped Robert, but refined for kidney disease. She described renal function, laboratory values, and treatment protocols with impressive medical fluency that had clearly been developed through multiple victim encounters. "Your glomerular filtration rate shows severe impairment, Mrs. Walsh. The protein spillage in your urine indicates your kidneys are literally breaking down. Without specialized nephrology intervention, patients with your exact lab values typically progress to end-stage renal disease within 30 days. She explained that Katherine's kidney problems were particularly dangerous because kidney disease often showed no symptoms until organ failure was imminent. Katherine felt fine and had no obvious health problems, which Dr. Coleman said was exactly why kidney disease was called the silent killer. "Mrs. Walsh, I've been working with kidney patients for 15 years, and your lab pattern is one of the most urgent I've seen. Patients with these exact readings who delay treatment have an 85% chance of requiring emergency dialysis within the month." Like the network that had targeted Robert, Dr. Coleman created medical urgency by claiming that Katherine's age and existing blood pressure made her situation even more critical, and that specialized kidney treatments had much better success rates when started immediately. "We need to begin emergency nephroprotective therapy today. This specialized treatment costs $13,000, but it's the only intervention that can reverse kidney damage at your stage of disease progression." The insurance Deception network. Dr. Coleman used the exact same insurance manipulation strategy that had worked on Robert. She explained that Katherine's Medicare would cover the kidney treatment, but the emergency nature required immediate payment that would be reimbursed once the life-saving therapy was documented. Emergency renal treatments require upfront payment because specialized kidney medications must be compounded specifically for your exact lab values. Once we begin treatment and submit the nephrology reports to Medicare, you'll receive full reimbursement within 45 days. She provided Katherine with specific Medicare codes and kidney treatment authorization numbers that sounded official. The same type of fake medical bureaucracy that had convinced Robert. Dr. Coleman seemed to have the same detailed knowledge of medical insurance procedures. I understand this seems expensive, but what's the cost of dialysis 3 times per week for the rest of your life? This treatment can prevent complete kidney failure and save your independence. Patients with your exact lab results have 95% kidney function recovery when treated immediately. Dr. Coleman created the same type of artificial scarcity pressure that Robert had faced, explaining that the specialized kidney medication was in limited supply, and Katherine needed to secure her treatment before other critical patients exhausted the available doses. Based on your lab severity, Mrs. Walsh, we've reserved one of our last 3 emergency nephroprotective treatment courses for your case. If you can't secure this treatment today, the next availability won't be for 6 weeks, which could be too late. The payment trap. Katherine felt the same overwhelming combination of medical fear and urgency that had trapped Robert. Dr. Coleman had created such convincing kidney failure panic that questioning the treatment seemed like accepting certain death. She agreed to the emergency kidney treatment. Dr. Coleman used the identical payment approach that had worked on Robert, guiding Katherine through wire transfer requirements to secure her emergency medication and ensure rapid treatment initiation. The Nephrology Treatment Center requires immediate wire transfer to compound your personalized kidney medication. This is standard protocol for emergency renal interventions when time is critical. At the wire transfer location, Katherine experienced the same hesitation Robert had felt. Dr. Coleman, still on the phone, used the same coaching techniques to help Katherine explain the payment was for emergency kidney treatment, which sounded medically legitimate. Katherine sent $13,000, believing she was preventing kidney failure. Dr. Coleman assured her that treatment would begin within 24 hours and provided the same type of fake medical follow-up promises that Robert had received. Mrs. Walsh, you've made a life-saving decision. This nephroprotective therapy will restore your kidney function and prevent the dialysis that would otherwise be inevitable. The devastating pattern. Like Robert's experience, Katherine never received any treatment. The phone numbers became disconnected, and there was no record of Northwest Medical Laboratory services. When Katherine's panic drove her to the emergency room for kidney evaluation, doctors found her kidney function was completely normal. Mrs. Walsh, your kidneys are fine. Your creatinine and BUN levels are normal for your age. You've been the victim of the same type of medical scam that's been targeting seniors with fake emergency diagnoses. The emergency room doctor had seen similar cases and immediately recognized the pattern. Katherine learned that she had been targeted by the same criminal network that had scammed Robert Martinez, but they had simply switched from fake inflammation markers to fake kidney disease results. The connected investigation. Katherine's case was immediately connected to Robert's investigation when she reported the crime. FBI medical fraud investigators revealed that both Katherine and Robert had been targeted by the same sophisticated criminal organization operating across multiple states. The investigation showed that after Robert's story gained media attention, the network had temporarily suspended their fake inflammation marker scams and pivoted to fake kidney disease scenarios using nearly identical psychological manipulation techniques. This is the same group that targeted Robert Martinez, investigators explained. They use the same scripts, the same insurance deception, and the same payment methods. They just switch the medical condition based on what's getting public attention. Katherine learned that the network had extensive databases of senior medical information obtained through illegal means, allowing them to target patients with believable medical scenarios tailored to their existing health conditions. The ongoing threat. Most disturbing was the discovery that Katherine and Robert were just two victims in a much larger network of medical fraud targeting seniors nationwide. The investigation revealed dozens of similar cases involving fake medical emergencies designed to extract large sums from frightened elderly patients. The criminal network showed sophisticated adaptability, constantly evolving their medical scenarios to avoid detection while maintaining the core psychological manipulation techniques that made their scams so effective. FBI investigators warned that the same network was likely developing new medical fraud scenarios, even as Katherine's case was being investigated, potentially targeting seniors with fake heart disease, diabetes complications, or other fabricated medical emergencies. Warning signs of the network. Katherine identified the same red flags that Robert had missed, showing how the network used consistent manipulation techniques. Unsolicited calls about urgent medical test results that patients never received. The network relied on creating fake medical emergencies to bypass rational thinking. Immediate payment demands for emergency medical treatments. All victims were pressured to send large wire transfers before they could verify the medical claims or consult with their actual doctors. Medical authority figures who knew personal health information. The network used stolen medical data to create believable scenarios that seemed impossible to fake. Emergency treatments only available through wire transfer payments. Legitimate medical treatments are never sold through wire transfer requirements to unknown medical facilities. The continuing fight. While Katherine never recovered her $13,000, her case provided crucial evidence linking multiple medical fraud operations across the country. Her cooperation with investigators helped identify pattern connections that could prevent future victims. Katherine learned the same lesson Robert had discovered. Legitimate medical emergencies are always handled through established medical channels, with proper verification procedures, never through unsolicited phone calls demanding immediate wire transfers. Most importantly, Katherine's investigation revealed that the network was already preparing new medical fraud scenarios targeting different health conditions, suggesting that more seniors would face similar medical scam attempts in the coming months. Final thoughts. Katherine's story proves that stopping individual medical scammers doesn't end the threat to seniors. These criminals operate as sophisticated networks that share resources, victim information, and successful manipulation techniques across multiple states and medical specialties. The connection between Katherine's kidney scam and Robert's inflammation fraud shows how these networks adapt and evolve while maintaining their core strategy of exploiting senior health fears for financial gain. If you receive unexpected calls about urgent medical results, remember both Robert's and Katherine's experiences. Hang up immediately and contact your actual healthcare providers to verify any medical claims before taking action. The fight against medical fraud networks continues, and understanding their connected operations is crucial for protecting yourself and other vulnerable seniors from their evolving schemes. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.